Mental health actually means to me where you're feeling your best in your head, in your heart, and it follows through your body.
Just simply means a healthy mind, just being whole in your mind, having a sense of peace, serenity, but really, like I said, just a healthy mind.
The state of one's mind at any given point in time, whether it be on the up or whether it be on the down or whether it be somewhere in between.
Taking care of your thoughts and your feelings just as much as you take care of your body.
Security of state of being, like checking on yourself, on your frame of mind.
When we take away that stigma, like when we make it as important, when we make it sound as important as taking care of your physical health. So making sure that you know that your mental is a part of your physical health. Your mental is a part of your body. And so it is a part of your whole body, and it's something that you need to take care of.
Is by implementing mental health throughout my day.
Is to acknowledge, the importance of how you're feeling. A lot of times we operate and we're like, nothing's wrong, and we have to keep on a brave face, but being honest about exactly how you're feeling in the moment and being willing to explore those feelings if they make you, concerned in any type of way.
So the creative arts really supported my mental health. You know, uh, it allowed me to center myself. It is something that has always been with me. And at a time where, like COVID, where we didn't have a lot of things, it really kept me um, focused and positive and centered.
The supports that have been most important to my journey has been being a part of my church, which is a faith-based organization, talking with my family about how I'm feeling. And music is like one of my biggest outlets. Being out in the sun is another way in which I love to just, feel and get back in tune with my environment and with myself and giving myself some alone time.
So the supports to my journey through mental health, I mean, of course, you have to be married to an amazing person, which I find in my wife. Um, you just have to be married to that person who has your back no matter what, who understands when you need your space and understands that when they need to invade that space, just to make sure you don't stay in that space too long.
I think as moms, as parents, we always focus on our children and what we have to produce and how we have to be there. But lately, I have been saying, Amber, you deserve the time. You deserve to give yourself some time. So if that's going out and getting my nails done or getting a new dress or just writing a simple note to myself, I make sure that I'm thinking about me first.
You can't be everything to everyone or anyone if you are not good first.
I'm a firm believer in professional counseling. I'm a firm believer in talking to a doctor, psychologist, psychiatrist, counselor, whatever it needs to be that for you.
It's okay to get your mind together and make sure that you get checked out. Then I think we could, get rid of that stigma of that, ooh, it's taboo. You're not supposed to go to get therapy. You're not supposed to go and, sit down and talk to somebody about what's going on in your mind.
Good evening, everyone, and welcome. Before we start, I want to introduce Andrea Contreras, a Noble Academy parent and certified medical interpreter, who will give the directions to switch to the Spanish channel for translation. Ms. Contreras, I'll pass the mic to you.
Buenas noches a todos y bienvenidos. Antes de que empecemos, quiero introducir a la señora Contreras. Ella es mamá y de Novo Academy y va a ser la intérprete médica certificada, la cual les dará las instrucciones para cómo cambiar el canal de instrucciones. Señora Contreras, le paso el micrófono. Hola a todos y a todas. Hoy estamos teniendo una interpretación en vivo para la sesión principal, es decir, Cuando estemos todos juntos y prefiere escuchar la presentación en español, puede hacer clic en el globo que aparecerá en la parte de abajo, de la parte derecha. Una vez que dé clic, verá la primera diapositiva que le señalará hacia dónde dirigir, ya sea español o inglés, la que usted prefiera. Ahora puede dar clic para español o inglés si es que así usted lo prefiere. En caso de que no pueda hacer o no pueda escuchar, por favor déjenos saber y puede escribir en el chat. Gracias.
We'll give everyone a moment to do that. Thank you. Welcome to Noble's Mental Health Matters Town Hall. No matter your affiliation with Noble, we are grateful to have you here. You just heard parent voices speaking on mental health and wellness. In recognition of May being Mental Health Awareness Month, this space was curated to share information, provide tips and insight, and inspire hope. As humans, we all face various challenges. There is no doubt that with all that has been endured over the last year and a half, COVID, racial injustice, civil unrest, depression, isolation, anxiety, and a host of other things, we all have room for healing. Please get as comfortable as you like because this is a webinar format and no attendees will be on camera. The chat will be open only for the first 10 minutes to allow for greetings, and then the Q&A will open if there should be any questions for our panelists. Our hope is that you will be open to opening your hearts and minds to the panelists and be present in this space tonight. Acknowledging that this journey to healing looks different for everyone, and the topic of mental health can be complex. We want to express our sincerest gratitude for you choosing to spend time with us this evening. On our panel, we have Unique Jordan, owner and founder of A Unique Perspective, LLC. Johnny Reed, president and founder of Project Heal. Susan Resco, CEO and president of the Jocelyn Center. Lucia Rodriguez, social worker in the Suburban School District. And our moderator for this evening is Titani Harris, CEO and founder of TMH Behavioral Services. Titani, I'll pass the virtual mic to you.
Thank you so much. I am so excited to be here and moderate this conversation, this much needed conversation in regards to mental health. Welcome to our panelists. Let's get right to it. So this first question would be for all of our panelists. As a person that supports healing and well-being for families and individuals, what does the phrase mental health mean to you? And Johnny, I'll start with you.
Excellent. Thank you so much for the question, Ms. Titania, and good evening to you all. Quite frankly, when I think of the phrase mental health, it automatically prompts me to think about brain health. For example, if I am to think about brain health, I'm to think about Biology 101 tells us that the brain and the heart are crucial to the proper functioning of the body. But throughout my educational experience, I learned PE, physical education, from pre-K all the way up to grade 12, and then onward through college and a master's degree. But my education was fundamentally incomplete because no one taught me about ME or mental health or brain education. And so as I reflect on the notion of mental health, it prompts me to think of brain health, because who are we if we're not holding ourselves, students, or our communities accountable for learning about one of the most important compartments of our bodies? And I'll pause there and invite the opportunity for my fellow panelists to share their perspective. Thank you so much for the question.
Yeah, and I like that you said brain health. Susan, you want to chime in?
Sure. So when I think of mental health, I really think about the whole body health, because really the only thing that separates our brain from the rest of our body is our neck. And the effects of our physical health and the effects of our mental health correlate and affect other parts of our being. So I like to think of mental health as being very comfortable in our own skin, and not, that's not to say that every day is going to be a great day, But for the most part, we're feeling good about ourselves. We're feeling, relatively confident, but we're also taking care and watching after our mental health the way we would our physical health.
Okay, thank you. Lucia?
Sure, I agree with everyone in the panel. I think that there's a huge connection with our physical bodies and how we feel emotionally, mentally, even socially. Our mental health impacts so many different areas of our life. So it's like a huge, everything is interlinked with how we're feeling. So I definitely think when I think of mental health, especially as a school social worker, and how I see how our students are feeling and how they're interacting with their peers, and anxiety and loneliness and things like that, everything is connected with how they're performing academically and socially. So definitely when I think about mental health, I think about a very important area of our overall life. It is definitely a connection to our physical self, because if we neglect our mental health, it is ultimately going to impact how we're feeling physically. It's definitely an area that is overlooked and not given the attention until it becomes too late and your body is having those effects. So definitely, I agree with everyone else, but I definitely think it's an area that it is linked to many other areas of our life and should be definitely not be ignored.
I like how you said psychological, like how you added that in. And Unique?
Yes, thank you for having me. I'm so excited about tonight because I feel as though there's like three pillars when it comes into understanding mental health for me. It's about self-awareness, as Johnny was communicating earlier. It's about that education. And most importantly, it's about that advocacy. I think a lot of times for us, we lack that connectedness with ourselves. And COVID has definitely, made us sit down and say, hey, take a look in the mirror and, really, really reflect on who you are and how you're operating. But the more that we're able to have that intimacy with self, we're able to better identify and communicate our emotions. I think that ongoing education needs to happen due to the fact that, we're going through so many life transitions,
Exactly.
Although I may be presenting one way today, an event can happen to me tomorrow. And, how do I navigate that? So, definitely ongoing education is important. And like I said, advocacy is so, so huge. I think that the more that we are communicative about mental health in different settings, so it shouldn't just be, siloed in, work or in school. Like we really need to have it in barbershops and beauty salons and just, in all areas, that we, live and breathe in. And most importantly, our homes. It really, really starts there. Because at the end of the day, if it starts off at home, then we can branch that out. But as Lucia was saying, that we can no longer be passive about our mental health. So even within that self-awareness and education and advocacy, like there has to be intentionality behind it because it's necessary.
Yes, thank you. And I just wrap that up and just say that when I think about mental health, I think about it in three parts: our psychological well-being, our social well-being, and our emotional well-being. And I often tell clients, when we talk about your emotional well-being, we're talking about how you think, how you behave, right? And how you respond to things and how you feel. But it's how you think, respond, and feel when life happens. And I think that's the most important in terms of thinking about your mental health. Thank you for that. So let's shift a little bit. When we think about our mental health, we know that the term mental health can often be stigmatizing, ostracizing, or isolating. Lucia, I ask you, what are some ways in which we can make the care and concern for our mental health just as normalized, as Johnny mentioned earlier, as our physical health?
Yeah, that's a good question. I think it begins with shifting the way we think about mental health. So kind of like in our brains and kind of, I know it takes time, but we definitely really need to be intentional of what we think when we think mental health. We need to think of it as equal as our physical health, trying to, that it's deserving of attention as we would our physical health. I know, like, if your stomach hurts, you will go to the doctor, but if you were feeling sick, some people might say, well, I'm not going to say anything, I'm going to hide it. As I said before, our physical and our mental health are all connected as well with other areas. So if you neglect, how you're feeling and not practice healthy coping skills, ultimately is going to impact, how you're feeling physically, especially like with our nervous system. Like if you were impacted with trauma or your anxiety, you start having other health ailments when it gets to be too late, basically. I think another thing that could be done is talking openly. So this is why this town hall is so important as well with all the other things that happened prior to this, because we're bringing awareness and we're also breaking the stigma about mental health. I think being open about mental health and your struggles is also very important. I don't think anybody would deny, having diabetes or high blood pressure, but people do deny saying, I have anxiety, depression, or I'm even taking medication. So I think just being open about that as well and sharing. I think also being very mindful about how we respond to others and their struggles and their feelings. So, again, using the example of diabetes or high blood pressure, I wouldn't make fun of someone because they have diabetes. I will still give them the same respect and attention and compassion and support that, because they have diabetes. So I would want to give that same support to someone with depression or anxiety. I think also it's important to, share on social media. Like there's so much things, a lot of resources available that, bringing awareness to what's going on and using the platforms, whether it's, Facebook, Instagram, to talk about it and be open. It's also a very good way of bringing, breaking down the stigma and bringing awareness.
Thank you. Johnny, could you add to that? Especially the part about breaking down the stigma, because I think that's important to note that.
Absolutely. Ms. Lucia, thank you so much for that profound introduction to the question. And I couldn't agree with you more. As we think about the notion of a stigma, we have to name that there's a negative stigma and there's also positive stigma. But more specifically, the question that I always like to answer is, how do we get here anyway? Right? In this country, the federal government negatively stigmatized topics of mental health as they specifically associated it with soldiers who came back from Vietnam War in the 1950s. Right? That's how we got here.
Yep.
Right? This hasn't been negatively stigmatized as a result of who we are today, but it was specifically done so. Furthermore, as I think about the notion of stigma and how can we normalize it, or quite frankly, level the playing field, at heart, I'm an educator. And so language is key. And so if we think through the topic of mental health through the lens of hygiene, I think this topic of discussion can then therefore become more relatable. For example, if we have the conversation around our physical health and our physical hygiene, children have been taught from pre-K all the way up until who we are today about the maintenance of our physical hygiene, right? I'm taught to groom myself. I'm taught to brush my teeth to maintain healthy dental hygiene. But on the topic of mental health, we too must begin to have the conversation of what it's like to have a clean mind, clear emotions, and be able to manage and healthily regulate those emotions in a fashion that positions us to present the best version of ourselves and to support others in presenting the best versions of themselves. And so as I come to a close, I simply name that language is an extremely powerful tool as we all begin to think through mental health and physical health through the lens of hygiene, as we practice and acquire tools of improving our mental hygiene and physical hygiene, we can become better versions of ourselves.
Thank you, Johnny, for that.
Absolutely.
So a lot of people don't know how to respond when they see someone struggling with their mental health, right? So Susan, can you share some of the signs we should look for in ourselves or in our loved ones that may indicate a time to seek additional support with our mental health?
Sure. So oftentimes you will see a change in behavior. So somebody that is perhaps normally outgoing may become more closed off, or vice versa. But it's a change in behavior that you really want to watch for. And it's hard for some people to reach out, but just remember that that question is often a lifeline, and people are desperately looking for that. And one of the things we do at the Joslin Center is teach mental health first aid, which we like to call CPR for the brain. And it helps teach people how to start that conversation. It gives you the confidence and skills to reach out. And so you can look on our website at joslin.org to sign up for a class. They're free. But, just reaching out and not being afraid to say, hey, how are you feeling? No, really, how are you feeling? Is a good first step.
Thank you. Unique, Susan mentioned change in behaviors. And as we know, as clinicians and mental health professionals, these behaviors look different in men and women and children. So can you speak more to specifically those behaviors and what those look like?
Yeah, so definitely, I think it's important to note that like we can all function at different levels and still have mental health concerns.
Yep.
So, sometimes it doesn't look like the person who is, secluding themselves in their room. It can be the high functioning person who, you think that they getting their goals met, they're getting things done, but they, have underlying concerns happening for them. And I also want to note that in general, that therapy should be a built-in support, right? It shouldn't be something that we necessarily run to as reactivity, but I think as all of us have shared in the same sentiment that this should just be a part of our routine, a part of our daily thing. And as you mentioned earlier, it's important for us to do an assessment of our thoughts, of our emotions, and of our behaviors, because really, the behaviors are the externalization of what's happening between that relationship between our thoughts and our emotions. So when we're, doing some reflection, think about like what's happening, because there's always an internal dialogue that we have going on that no one can hear. So, as we are assessing whether or not I need mental health supports, consider those thoughts. Are they critical? Are you being very judgmental of yourself? Is there like a hypersensitivity into where we personalize things? Because again, we do this so often, and within our brains, we don't even recognize because we've been so conditioned to thinking these ways. And so moving on to emotions, right? So how does our thoughts then impact our emotions? Am I now anxious? Am I nervous? Am I lacking confidence? Am I depressed? So again, just really, really noting that relationship between the two, because again, that externalized behavior, it can go undetected when we don't do that thorough assessment of, again, how are my thoughts then impacting my emotions? And again, just that externalization of, am I being secluded? Am I lacking satisfaction at my work? Just kind of, again, doing a thorough investigation of what's happening in the relationships between those thoughts, emotions, and behaviors is important.
Thank you for that. Thank you so much. So as it was mentioned earlier, we know this year has been tough with COVID-19, civil unrest, racial trauma, right? I want the panelists to talk about what has been some of the most pressing concerns for you personally, people close to you, or the people that you serve during the year. And Susan, I'll start with you.
Sure. So certainly the pandemic and the social unrest has affected so many people. But what we're also seeing, the heightened awareness of mental health in the media, all the talk about it, it's giving people the confidence to say, yeah, I've been struggling for years and I'm going to do something about it now. So it's normalizing this process of seeking help. And so what we're doing, we're seeing a lot of people who have been suffering for years, but they're just starting to reach out now. But it's creating a tidal wave of demand for sure.
Johnny?
I think for me, in my work, facilitating trauma-informed education for adults in the classroom, beyond the four walls of the schools, and facilitating trauma-informed education for parents, the question is always, what does it look like and what do we do? And on my end, I think that we had, throughout the numerous conversations we've had with partners in more than 15 states, the dialogue is the same. But what we have to name to our participants or even individuals who are listening in today is that trauma and stress are a part of life, right? We cannot prevent it. It is inevitable. However, similar to what Ms. Lucia and Ms. Susan were stating early on, is that we can well prepare ourselves with healthy coping mechanisms to confront the stress and trauma once we experience it, so that an experience isn't debilitating, but it's manageable for each and every individual.
Thank you.
You're more than welcome.
So what I've been seeing greatly, and I'm so proud of my community, is that more Black and Brown persons are seeking mental health support. And going back to what we were talking about earlier about the ostracism and the stigma that relates to mental health, I've been seeing a lot of persons, again, Black and Brown, who are reaching out and saying, what do I do? Please help me out. But I think, most importantly, it has attributed to just more representation of us Black and Brown clinicians. Because as we know, or some of us may or may not know, but we make up 6% of the psychology, work field. So that is a huge detriment, and that greatly impacts, persons, again, of Black and Brown descent, to reach out. So what I've been seeing greatly is, just that basic education, because there weren't resources, there wasn't representation to say like, hey, these are emotionally safe places for you to seek these supports. I've been seeing a lot of folks, I've been doing a lot of work in terms of boundary setting. Boundary setting is so huge because it impacts all areas of our life. But again, a lot of us don't know that we have access to exercising that muscle to set boundaries even within our families, because a lot of us again, have that connectedness and intimacy within our families. But, how do I set boundaries with my work? How do I set boundaries with my friends, et cetera? But again, there's just been a huge outpour, which can be, overwhelming as myself as a clinician to serve all of these people. And so I always encourage, again, those who are in the psychology field in terms of being Black and Brown descent to get out there, get your license and, really come out and serve the communities, because we are in desperate need and we're ready for that.
Thank you. Lucia?
Yes, so something that I've noticed, specifically working in a school that is predominantly Latinx, there has been a lot of anxiety and grief as well, specifically because the community where I work with, had to go out and work. So a lot of our kids were, anxious about, parents getting sick, getting themselves sick. Parents, I've had students where their parents have, at least one has passed away. So a lot of our kids have struggled in that area, anxiety and grief. But another thing that I've noticed is teachers and school staff have also really struggled in the area, but has also stepped up to support our students. Educators are like amazing in the way of how they're helping our students and our parents, because there's a lot of demand on teachers, specifically during this pandemic time, of like finding new ways of teaching, teaching students, reaching out to them. There's 1.5 social workers in my school, so there's not enough of me and my peer to like help, the whole school. So I really do like that the teachers really support their classrooms by doing mental health check-ins with all the students, doing restorative circles in the morning, asking fun questions, participating in all these different activities. So yes, it has been very hard for our families and also for our school staff, but they have all stepped up and really worked together and find creative ways of reaching out to our students to decrease and diminish, the feelings that they might be having, but also to reach out when they're feeling, overwhelmed or stressed. So like with their morning check-ins, they've also like reached out to me or reach out. We've helped lots of parents, and it's, as other members here have said, the conversation has started. You know, even educators are helping and working. They're reaching out to me so that we can reach out to parents and reach out to outside resources to help as well. So the pandemic has been, you know, very hard on everyone, but it had also, you know, we have to see like all the good that has happened as well, you know, the supports that have been in place and how people have stepped up to help our children and help ourselves and help each other. So that's what I've seen so far.
Thank you. And I'll just share, I like that Johnny mentioned trauma, right? I want to spend a little bit of time talking about trauma, if that's okay, because I think that's important in this conversation. So when we think about trauma, we know that trauma is a powerful emotional or physical response to a distressing event, right? Such as the war, the death of a loved one, abuse, or car accident. I know in my work, I primarily work with Black men. And so I've seen an increase in what's called this racial trauma, right? In terms of not just Black men, but Black and brown people. So we know that racial trauma is a powerful emotional response to racial bias, systemic racism, discriminatory harassment, and police brutality. So I've seen a lot of folks come into our office just to talk about the racial trauma, right? And so when we think about trauma, we think about PTSD, right? And post-traumatic stress disorder, which is a mental health disorder that is triggered by experiencing a terrifying or traumatic event, right? But I want to know if the panelists are familiar with race-based traumatic stress, which is not in a DSM-5, but should be. But this is a mental distress and harm that is triggered by the onslaught of racial bias, systemic racism, discriminatory harassment, and police brutality. So I want to get some feedback on that from our panelists, if that's okay.
Absolutely. I'm curious to know what's your specific question so that I can respond in a very succinct answer and not take up a lot of airtime.
No, just talk about if you've seen it in your work, this racial trauma. I know we don't talk about it a lot, right? You talked about trauma early, but just in your work, have you seen some of the effects of racial trauma? And if so, what have those effects been that you've seen? Yeah.
Absolutely. I facilitate trauma from education in more than 12 states. I used to do it in person, and as a result of COVID, we had to do it virtually. Subsequently, I was traumatized as a result of that because I had to take a step back and use a new modality to get the message to people around the globe now who are in need of stress and healthy ways to cope. Full transparency, racial trauma, quite frankly, haunts me. More specifically, because as a 5-year-old, I watched 8 police officers, gun drawn, till my father get down to the ground, and I didn't know if he was going to make it or not. Furthermore, I received news that my brother was murdered as a result of gang violence and such. And so as the onpour of public police brutality spewed across social media, in addition to newspaper clippings and conversations with peers and friends and also colleagues, despite their racial identity, sometimes they would trigger me. Sometimes they would traumatize me when they thought they had the best intentions. And so through my work, I literally re-traumatize myself every time I have conversations with participants around what it means to be trauma informed, what it looks like, and how it impacts us. To the extent that I facilitated a trauma informed professional development, and a white man left in the comments that, you know what, every time I get on and I present trauma informed education to him, I trigger him because it comes off as aggressive. It comes off as if I'm telling him about himself and things that he needs to change and revise so that he can be the better version of himself. But I honor that white gentleman because he stayed on to have that conversation with me around how I triggered him. And the notion was that I was emphasizing elements of his emotional past that he didn't know about. And it was becoming unearthed through our conversations around stress and trauma and racial tensions in the area of Chicago. And so to land this plane on this element of race-based trauma and how I have seen it in my work, a number of us, albeit white, Black, or whatever your social identity marker is, the element of the direct race trauma can impact you, and the secondary traumatic stress of the race-based trauma can impact you as well. And it can paralyze us as we don't know what to do.
Thank you, Johnny. I appreciate that. Anybody else? Nick, would you want to add to that? I saw you shaking your head.
Been nodding away. Okay. Yeah, I wholeheartedly, and thank you, Johnny, for that transparency. Let me just say this: a Unique Perspective LLC was birthed out of racial traumas that I experience, again, nationwide and within my workforce. Obviously, vicarious trauma is very, very big. But again, I birthed my private practice out of the lack of support that I received amongst my white colleagues, who are all counselors themselves, who all have masters and, all these great certificates and degrees, but could not sit down with myself and other Black clinicians who we rub elbows with 12.5 hours a day to talk about, hey, are you all right? We never had that conversation. And it wasn't until I had a little moment at work that kind of set it all off, essentially, because I said, what a disservice it is for me as, again, your colleague, who we can talk about everything under the sun, but we can't necessarily talk about this. So it's been a ride. And like I said, I had to depart from that space because I said, again, my community needs a safe place to explore these things. And so within my private practice, a lot of my clients have been open and sharing so many traumatic experiences, again, racially based, that have just been desensitized and normalized, you know what I mean? Just saying like, well, this is just, again, how my life has been. So a lot of times for me, I'm just listening, affirming, and agreeing, in that space, and, saying that it's okay, whatever sentiment you have, whatever feeling it is, that it's okay for you to lay that down, but most importantly, for you to identify it and release it. Because a lot of us are stuffing, and just trying to be really in survival mode. That's all that we've been in throughout our lifespan. So, again, for me, it's important within my private practice to say, you have an avenue, you have a space. This is not just a compartment of who you are, but again, this has been your human experience. So I've opened doors to, share and explore that.
Thank you so much for sharing. I really appreciate it. I know I stirred the pot a little bit with that question, but I felt it was important to talk about that. Lucia, did you want to add anything to that?
Sure. I definitely want to add. I also think that we need to think about generational trauma when we're talking about racial trauma. I know I could always speak about my school experience because being a school social worker, so I'm going to go back to that. Our school this year we trained all our teachers on trauma. And we talked about the different things that could possibly, impact a child and how it changes their bodies. And one of the things that I think was really important for them during this training is to talk about generational trauma and how our students have that imprinted in their DNA and how it could impact how they behave within the school system or within the classroom day or just in general. So I think it's really important that, not only do we think about, the racial and, how trauma could impact, but also that imprint that they had based on the generational trauma that is carried, through slavery, through immigration, like coming from a different country and all these things. So I just wanted to add that's also very important because when we did the training with the teachers, that was something that we definitely wanted to explain to them and really imprint that in them, that, how it has changed this child's body, because it was passed on and how it impacts them in the classroom. So I think, I wanted to share that's also something that I have noticed within ourselves in our school.
Thank you, Lucia. Susan, feel free to chime in. We want to get some feedback from you as well, too.
Well, I'll just be a little vulnerable here and say that, it was a year ago with the riots that I remember very clearly having an all-staff Zoom and talking to the dozens of clinicians that work at the Joslin Center and saying, I know this has been a very hard time for our clients and we're there to support them. And very bravely, one of my clinicians, a person of color, said to me privately, she's like, what about us? we're experiencing the same trauma, and it was
shared trauma.
Yeah, and it was a real aha moment for me. So as a result, we have done a very intentional deep dive DEI training to help not only those that haven't experienced it better understand it, but also those who have experienced racial trauma find the words to talk about it and to express how things make them feel and trigger them. And it's been really very helpful.
Thank you, Susan, for sharing. I thank each of you for sharing and being vulnerable in this moment. So we're going to shift gears a little bit. As we know, the world is opening back up, right? And so, Unique, I wonder, what can people do to prepare mentally to transition back? And if they aren't ready, how should they handle that? And what are some things they can do to sort of cope with that process of not being ready to sort of get back into the world?
Yeah, I'm excited. I'm ready to get back into the world too.
Me too.
Yes. I think probably collectively we all have an excitement to, go back. Well, a lot of people want to go back to normal, but we can't go back to those spaces anymore. So essentially we have created a new norm for ourselves. And, what does that look like for us? Again, most of us we're looking forward to like weddings and, just different outings, all of these things that were postponed, trips. I was supposed to go to Bali for my birthday. I didn't make it last year. I was sad. So, I'm definitely looking forward to traveling. But, to answer your question specifically, I think that it's important for us to create routines now. Start now, get in that preparation mode. It's so important that we have a sense of structure, because when the doors open up to outside, that distractibility is just gonna flood in, right? So we're so excited to be like, let me get into this, let me get into that. And we may, haphazardly neglect some of the things that we have been working on in terms of trying to create some stability for ourselves. But I think, it's again important to do an assessment of like, how am I operating at work, right? So it's important for us to continue, or if we're not doing it, to take our leave and our PTO, to take mental health days.
Yes.
We have earned them, we have access to them, use them. That's so important. Also doing like a check-in of self to figure out, like, am I satisfied at my work? Because we know work really takes up majority of our life, whether or not we recognize it. And to be in a space where we're not satisfied, we're not happy, that can also play a role in our mental health. I think it's also important to, do some meditation, take breaks, deep breathing, all of these things. So psychologically, it's important for us to, again, maintain those self-care practices that we've been putting in place. Again, maintaining those boundaries that we've been trying to put in place is also important. And connecting with spirituality. So just kind of like covering all of the realms, all of the areas of your life, so that you can feel fully prepared and also maintain some stability and not get sidetracked, because that excitement can be like, oh, well, I don't need therapy anymore, or, oh, I don't need to take my medications anymore, but just to, again, maintain that routine that you have already established. And even with your physical being, right? So remaining active, exercising, yoga, walks, all of these things are important. But like you said, mentally, we really, really have to, again, maintain that intentionality. We can't say like, oh, well, that was something I was dealing with, in the winter or in the spring, but this is something that, again, has to be integrated in my day-to-day life. And I can't be neglectful about it. So just covering all your bases.
Thank you for that. I want to get the other side of the coin. You're really excited to get back out. But there are some folks who have some, and I'm with you, but there are some folks who have some anxiety around the world opening back up and transitioning back to school in person and to work and just their day-to-day. So Johnny, could you give us some tips on how that person could deal with some of the anxiety around the world opening back up? Because some folks haven't left their house since last year. So how do they deal with this?
I honestly feel as though you're in my mind and in my heart, because I am one of those individuals.
Okay.
Transitioning from doing everything in person and then transitioning to doing trauma-informed professional development online. I was traumatized I experienced anxiety. I don't like being on camera. I like doing everything in person, but I had to shift and transition because participants, our partners, needed the services. And here we are yet again, preparing to transition back to doing things in person. And partners across the nation have already requested services over the course of the summer to have trauma-informed professional development done in person for more than 100 of their staff members. And yet again, I am traumatized. I am experiencing gross anxiety because I now have to shift my heart, my mind back into new structures, new systems.
Yeah.
And so to answer your question, Ms. Titani, Miss Unique put it so eloquently, but to add a layer of specificity, what she underscored were the 6 categories of personal wellness, right? Those 6 categories are emotional wellness, occupational wellness, physical wellness, spiritual wellness, intellectual wellness, and then what's the last one I have? It social wellness, right? And so as I'm preparing to go back to war with trauma in person, I have to think through, how am I going to mentally prepare myself to have everything I need to be able to self-inflict trauma upon myself to educate parents, students, school staff, and caregivers. And quite frankly, I am preparing as if I am preparing for a vacation. So I create a list and literally name all the things that I'm going to need. If I am triggered while implementing a trauma-informed professional development session, what song am I going to play to help me simultaneously regulate my emotions and help participants think I'm okay, but in actuality, I'm having many anxiety attacks. And for the educators and parents who are listening to this, think about what it feels like on a Sunday night right before you go to school on a Monday morning. I experienced that nonstop, and I have to think through the strategies of calming myself in real time to transition back. And so, undeniably so, I am traumatized just thinking about going back into doing the work in person. But I know for a fact at the conclusion of every trauma-informed professional development session, there's going to be a parent, a caregiver, a teacher, or a student who appreciates me leaning into the stress and trauma and exercising the development of my own emotional resilience to support theirs.
Yeah, I like what both you and Unique said, and I'll just wrap that up by saying, I think there's 2 important things to also touch on. We talk about the world opening back up for some of us. I think number 1 is you have to do what's best for you, right? And also we can't shame others in the process on their choices. So I think it's important that we keep that in mind. Yeah. So we're going to talk about parents. As we know, this is the Noble Network. We have lots of students, and I don't know if we have any parents on the panel, but as a parent or someone who works with parents, how can you parent your best and also take care of your mental health? Unique? And what are some tips that you would give parents of students in terms of taking care of themselves and their mental health?
Yes, yes. So I am kind of dual in this sense that, I am a parent. So it's very important for me to be mindful of what I'm modeling to my child. I have a 5-year-old who is, she is a sponge. She's her mother and she's her father too. Both of us are counselors. So she cannot avoid getting out of this intuitiveness that she has. Whole thing. But it's important for me, and I share this a lot with mothers, this can expand to fathers as well, that a lot of times we are living, we're existing for others and not living for ourselves. So that's a huge, huge piece to understand. So when we're existing for others, again, a lot of times we're making sacrifices, we're pouring into others before ourselves. And before we know it, we lose a sense of identity. And a lot of times as parents, again, our hyper focus is on our children and making sure that, they're raised in the most nurturing and, comforting spaces. But when they leave the nest, we're left to be like, well, who am I? What am I supposed to do? So it's important that we are active in our day-to-day lives in terms of expressing our identities and living within that. So a tip or tips that I will have for parents is to be you, to laugh more, to do the things that you enjoy doing. For me, personally, a lot of times my daughter loves for me to go to sleep with her every night. She's like, can you sleep with me? And I'm like, okay, cool. I'll lay with you until you, pass over into your sleep. But I'm going to take an hour or two for me. I'm going to take an hour or two to read a book. I'm going to watch my favorite Netflix show. I'm going to eat ice cream. I'm going to do whatever makes me feel good to have that sense of self, right? So I think it's just really, really important that, again, as we are parents, just to living your life as well. Your life does not have to stop, because before your children, you were a whole entity, and you still are. But I think it's also important for us parents to ask for help. A lot of times, we feel very proud, or we may feel like, okay, if I ask for this support, I may seem incompetent or not strong or incapable of doing my parental duties. But no, we all need those breaks. We all need that time to say, like, hey, can you watch them for 2 hours while I just stroll in the mall, or just take a walk in the park, whatever it may be, to, again, bring that sense of identity, to bring that sense of peace to myself. So it's just important that, again, as parents, we humanize ourselves, because we can be so critical too, in terms of like, oh, did I do this right? Or I didn't meet all of the tasks that I had on my list, in terms of like all the things that were, meant for the day. And that actually segues me a little bit into self-affirmations that I do as a mother, because it's just so many things to do, and so many occasions to rise up to. But one of the self-affirmations that's so important and near and dear to my heart, I say, I have done all that was meant for today.
Thank you.
That's it.
Thank you for that. I want to get a tip from Lucy, if that's okay. Do you have any tips for parents that you could share?
Unique said so many amazing tips.
I know, right?
What else could I add?
I know, I'm sitting here like taking notes.
I'll take it. I agree with everything else. I think I would add something about comparison. I don't think that you need to compare your journey as a parent with other parents, because I feel like that will make you feel worse. Even if you're not a parent, like, no one should ever compare. And I think we tend to do that, especially with social media. Like, we're like, well, this mom did this, and she's cutting, watermelon hearts, and you're doing these perfect lunches. And, we definitely have to be very mindful about comparing ourselves to something that it might not be. It might just be like a phase, or it might be something that it's unique to that mom or dad or person. So comparison is key. So always remember that. And I think it's important that being open about emotions and being regulated with how you feel, because if you are dysregulated, your child will follow along. So I think just kind of being mindful about that. In addition to the self-care, I think seeking support is also very important, but also, seeking support from the schools. Again, as being a school social worker, I always really enjoy when a parent, calls the office, hey, I'm having some difficulties with my child. Again, with that dysregulated parent, dysregulated, child, they'll call and say, hey, can I speak to the social worker? So just kind of reaching out to, the school staff, for support, like for resources, just in general, because, there's always, a caring teacher or, caring individual in school that can provide the support or the resources. So I think those are additional tips that I would share as well, along with all the other wonderful things that Unique said as well.
Thank you, Lucia. As we wrap up this conversation about mental health, I want to hear from all the panelists in terms of some words of encouragement and support that our viewers can give to someone in their life or themselves if they're struggling with the mental health. So what are some supports or some words or encouragement that they can give those people in their lives? Or better yet, how do they go about helping someone in their life who is struggling with a mental health issue? And Johnny, I'll start, or Susan, I'll start with you.
Okay.
No, John, Susan, go ahead. Nope.
I think the most important thing that you can do is to validate people's emotions and their feelings. And don't tell them, oh, you'll be okay, or not a big deal, but just to really listen and lean in and say, I hear you. And wow, that's got to be hard. That alone can make a huge difference in helping people.
Thank you. Now, Johnny.
Along those same lines, language being powerful, naming that if this is for yourself or if this is you having a conversation with someone else, that there's nothing wrong with you. Life is simply happening to you. you are naturally experiencing emotions, and you set the pace for where and when you're ready to restore that emotion and continue moving forward.
Thank you, Johnny. Unique?
Sorry, Johnny stole my answer. But that's okay, Johnny. I'm just gonna expand a little bit because I agree with you that language is so important. And a lot of times, we'll ask even ourselves or relatives or friends to say, what's wrong with you? And even saying what's wrong with you, that can make that person or even yourself feel as though you're defective or that you have some malfunction going on with you. And as Lucia was saying earlier about that comparison, because sometimes we can do that to ourselves or even our family members to say like, oh, we grew up in the same household, we had the same shared experience,
Yep.
What happened to you? And again, I feel like that's an invalidation of that person's sensitivities, their experiences, their temperaments, and just, again, who they are as individuals. So it's just important that, again, we are very careful about the language that we use.
Yep.
And also listening. A lot of times we violate people's emotional and intellectual boundaries by putting our 2 cents in the mix when it wasn't necessarily solicited or warranted.
Yes.
So, just being a listening ear to, say, I'm here. One of my friends always puts that phrase out to me whenever I'm going through something. She just says, I'm here. So, that gives me an invitation to just show up however I choose to, or to share whatever I choose to share. So again, it's all about, again, our language, our approach, and our responsiveness to whatever that person is experiencing or going through.
Okay. Lucia?
I think everybody stole my answer now.
I know, right?
Okay.
Okay.
No. I agree that language is very important. Using supportive statements like, what can I do for you? How can I help you right now? I'm here for you. So that listening, the being present. But something that I would say to a person that is supporting a loved one is that you need to take care of your well-being as well. You cannot, pour from an empty cup. So when you're taking care of others, you need to take care of yourself in addition. So I think that's super important, especially when you're supporting others, that you have to think of yourself as well. So in addition to what all our other panelists said, I think I would like to add that as well.
Thank you. And I'll just wrap it up by saying you guys nailed it. I think the first thing is to start the conversation, right? To bring it up, to talk about it. And also, especially for those who are, who have family members who are struggling with mental illness, I think it's important to educate yourself, right? Try to understand the symptoms and the conditions that they're dealing with, right? Because then you'll be better equipped to deal with them. And then also paying attention to warning signs. And like you said, Lucia, taking care of yourself. So thank you. So that concludes the end of our conversation. I'd like to thank the Noble Network and thank all of our panelists for this much needed conversation. It is my hope that we continue to have this conversation. But before we wrap up, we're going to shift to our audience questions, if that's okay.
Absolutely. So Titani, I'll go ahead and read the question. We have one question in the Q&A section for now.
Okay, no problem.
And if people start to have some questions, once these responses start rolling, we'll go from there. The first question is, how do you suggest teaching the difference between mental health and mental illness?
I can answer that if that's okay. So to keep it very simple, I don't want to get too clinically and I will hope my fellow clinicians and mental health professionals support me on this. When we talk about mental illness, we're talking about things like depression, anxiety, right? That's a mental illness. When we talk about mental health, we're talking about your psychological well-being, which is how you operate in relationships, your day-to-day, your autonomy. We're talking about your emotional well-being, how you think, how you behave, how you respond, and how you feel. And we're talking about your social well-being, your values, and your morals. If I could just make it as simple as possible in terms of the difference between your mental health and a mental illness.
Thank you. We have another question. What resources are available specifically for teens who may be experiencing mental health problems for the first time?
I have a resource. So I am the owner of TMH Behavioral Services. We are a group mental health private practice in the Bronzeville community, serving men, women, and children. And we offer currently a free online teen support group for teens, male and female, ages 13 to 17. Anyone between that age range can just go to our website. We have these groups every 6 weeks and they're free. So that's one of the ways that we're supporting teens during this time.
And I'd like to, if any of the other panelists may have any suggestions or resources to offer, also, I want to open it up for them.
Sure. So I mentioned the mental health first aid earlier. There's a specialized program for teens called Teen Mental Health First Aid that teaches them the signs and symptoms of mental health challenges and substance abuse challenges. And just as importantly, why it's critical to reach out to a trusted adult and not to try to keep this to yourself or to manage it yourself. And then there is also, we have dozens and dozens of clinicians at the Joslin Center, and we're still doing virtual therapy. So we welcome calls.
Thank you. So I'm not sure what the exact question is, but it's around coping with grief and loss. So I guess maybe tips or feedback that any of the panelists may have for coping with grief and loss.
I could answer that. I think it definitely takes time and everyone grieves differently. So I think it's important to decide like how you're feeling, how you talk to someone. Definitely if it's a child, like reach out to the teacher so that the teacher can be aware of behavioral changes. Talk to a mental health professional if you start noticing that it is impacting a child or a person's ability to do their everyday life. But I think it's important that like I said, everyone grieves different. And so to give yourself some time to be kind to yourself, and just kind of seek out support and friends and loved ones, because it is tough, especially when you lose someone and your life has changed dramatically and drastically. So definitely give it time and reach out to loved ones. That's one tip I would have.
I also want to note that with grief and loss, it's not linear. So there are going to be different stages and different reactivities to coping with that loss. Did I cut out a little bit? Were you able to hear me? Okay. But yeah, just understanding that, you may go through different stages. So, at one point you may be angered, by that loss. There may be a point where you feel as though this was an inconvenience to you, but whatever those feelings are, to own them and just understand that this is, as Lucia said, going to be an ongoing process, especially given the significance and the intimacy of that relationship. So, whatever those feelings are, to own them and also seek out the supports, not to be isolative, in your emotions, because, that can increase the symptoms, or again, just that, whatever feeling that it is that you're experiencing, it really intensifies it when you go into an isolative mode. But again, just normalizing that whatever emotion that it is that you're, going through at that time, because it's not going to be, a straightforward process, and that's okay.
And I'll just add, not allowing others to tell you how you should grieve or how long you should grieve, right? And understanding that your grief is your grief, and how you deal with it is how you deal with it for that moment. I think lots of times we often say, well, she should have been got over that. And we're not understanding that, everybody grieves differently and everybody grieves for their time differently, right? So I think that's important as well too, to recognize that your grief is your grief and that moment is for you.
If I may add one extremely important element of grieving, it's to cry. It is healthy to cry, right? Crying is the body's natural way of relieving stress, and it is okay to cry. Right? I know there are maybe a number of individuals within the Noble Network and beyond who share my identity marker as a Black male, or who may be a male in general, or who may be non-gender conforming. But and you might have learned in your culture or in your community that crying is an element of weakness, but it is literally the body's natural way to relieve stress. And so to be reluctant to crying is literally being reluctant to expunging your body of waste and stress that it needs to get out in order for you to begin to start a process towards healing.
Thank you all for your responses. So our next question is tips for self-care when personal and professional lives feel more than full.
Self-care. So this term so I will say this for the person who struggles personally and professionally, my favorite form of self-care is the word no. Learn to say no. If there's any tip that I can give in terms of self-care, especially for the working professional, you're raising a family, you have to learn to say no. And when you say no to others and things, you say yes to yourself.
Thank you. As an employer, what are ways that we can ensure we are being supportive and understanding to people's unique needs?
Well, I can say a couple of ways that we are really want to emphasize that people take their paid time off, especially during this time when we can't travel so much. It's still very important to recharge your batteries, and also to do employee surveys and have an employee engagement committee that gives feedback and suggestions for ways, little things that we can do to just make it a bit easier and show our sincere appreciation for our staff.
I was also going to say, as someone who owns a business and has a team, one of the things that we've done at TMH is that not only do we say, okay, you have your PTO time, but I mandate my staff take their PTO time. So if I look in my books, and if you haven't taken time off in this current quarter, I force you to take the time off, because I think that's so important. And I think that it's important that as employers, we support our employees and their mental health. I think for so long, there's this culture of that the employees feel like they can't take the time off, for whatever reason, because it's the way society, presents work, and we have to work. And we know this, but being really diligent and intentional about supporting your employees and having them take that time off, I think is also important.
Thank you. The next question is, what are some mental health resources for those who might not have good health insurance or health insurance at all?
So one of the things we've done at TMH, so I have a private practice and behavioral health clinic, but I recognize there were brown and Black people who looked like me who couldn't afford our services. So we offer pro bono services, and we also take straight public aid. So we take the Medicaid card, we accept, and I believe everyone can qualify. Anybody really can qualify for the state insurance, I believe so. So there are other community health providers who take Medicaid, but I know we also take Medicaid as well too. And also reaching out to community mental health providers, churches, looking at websites like Psychology Today, Therapy for Black Men, Therapy for Black Girls. I know Chicago has a online clinician support directory. There are plenty of clinicians in that can sort of provide those resources as well too. But there are options for folks who have little to no insurance, and TMH Behavioral Services is one of those places as well too.
Just to add, I'm sorry, Susan, go ahead.
Go ahead. No, you go ahead.
Oh, okay. But just, to add more resources, Open Path Collective is another organization that provides, affordable therapeutic supports. You can also look on SAMHSA's websites, where you can find, again, locally funded or government funded agencies that can provide that help for you as well. That's all I wanted to put in there. Go ahead, Susan.
Yeah, I would just look for Medicaid providers or any provider that offers a sliding scale fee. But then there's also a lot of free support groups through, say, NAMI or some of the other national organizations, Families Anonymous, any number of those support organizations that will offer free support.
Thank you. How do you set boundaries with family members that don't understand mental health?
I think it's a question for you, Neek.
Uh-oh.
No, you're fine. No, go ahead.
No,
Forgive me.
it's
Forgive
all
me.
good.
I think Lucia was starting to answer.
Okay, go ahead, Lucy.
No, I think Ms. Harris has said it very well. Like, just say no. And I mean, I don't think there's any other way of saying it. Like, maybe say, I can't today. Like, there's other ways of saying no. I think I've seen posts on social media, is like other ways to say no, like not today, maybe tomorrow, like there's other ways of still saying no, but basically you just have to say no. And I think they have to respect that. If they don't, then, you just still don't do it. It's just plain and simple. I think that's the best way to do it. There's no going around it. I don't know if anybody else has any other idea.
Well, what I would say in terms of setting boundaries, you have to be clear and concise. You have to be very firm about what your values are, again, in terms of what you are accepting of versus not, because sometimes when you leave that room of maybe tomorrow, when you really don't want to do it at all, that leaves room for others to kind of insert themselves to come back around to you, because they definitely will, to say like, hey, remember you said for me today. So again, just being very, very clear and concise about, again, the boundaries that you want to set with that person. But I understand that even within family system is so challenging. And even like I said, when I did my 6-week boundary setting workshop, family was the hardest one. And I think, understanding, and this is kind of the fundamental, I don't want to break it down too much, but understanding some of the fears that we have is like the starting point, because we fear rejection, we fear loss of that relationship. Again, we just fear so many things, and that keeps us from setting those boundaries, right? But once we're able to identify, okay, this is why I have a difficulty in terms of saying no, or maybe even setting a compromise. So that's a little sidebar in terms of like boundary setting. It doesn't always have to be yes, no. And I think that as a society, we think that it's black and white, but there are compromises that you can set within those boundaries to say, hey, although you asked me to drop you off and pick you up from your appointment, I can only take you there. I got other things to do. Somebody else is going to have to pick you up. So, yeah, understanding, like I said, some of the fears and anxieties and working around those challenges in order to set your boundaries with your family members.
If I may add a layer of context or an additional layer of support, Miss Unique, to substantiate the insight, the brilliance that you just shared, there is actually a text, a book titled Set Boundaries, Find Peace, a guide to reclaiming yourself. And this is actually a text that I have been leveraging to support family members, parents, and caregivers as they have had conversations around stress, trauma with their students, with their partners, and within their families. And so again, the name of that text is Set Boundaries, Find Peace for Yourself, a guide to reclaiming yourself.
Okay. So the next question is kind of centered around teen behavior. How do you approach them when they're modeling the behaviors, like the best way that they see fit to deal with their emotions? How do you approach as a parent to your teen?
Well, I think the most important thing is to talk to your teen, not like they're a little kid, but as an adult, and just to be very honest. And in terms of modeling behavior, one thing that I think is really important for parents to do is to show your kids when you are struggling. You can say, I had a really bad day today. I said something that really hurt somebody's feelings, and I feel really bad about it. And that teaches your child social emotional maturity, empathy, and your child, you could say, what do you think I should do about this? Because I feel really bad about this. And just be, honest and real with your kids. And we all remember when we're little kids and we thought our parents were perfect and could do no wrong. It's important to show kids that we are human too.
And I would add also, we know that, teens are going through this as well too, right? On top of the pandemic and everything that's happening, but also being a teenager. And so I would encourage parents to just ask their teens, how can I support you in this moment? Right? Because I think oftentimes we assume because we're the parent, we know what to do, but all kids are different, but just asking them, how can I be more supportive? What do you need from me today as your parent, as you go through this?
Thank you. And panelists, we down to our last 3 questions. So power through, you all are doing a great job and thank you so much. Have you seen a shift from trauma-informed care to healing-centered engagement in school-based spaces? And if so, how would you characterize the difference between those approaches?
I could answer the first part. I think, or because I know there's 2 parts to it, but I think in what we're doing in schools at the moment is we're doing the teaching part, like how is trauma impacting a child or their academics. I think school staff and parents should first know the foundation of like how is trauma impacting in order for us to move to the healing part next. So what I've seen so far is that we started the conversation on trauma and the impacts on it. And then we touch on like, how can we heal, the relationship building, the next part. I know in our district, we're doing it in like in sections, like, we're doing the trauma informed, teaching the staff, rolling out a few, restorative circles. And then next year, we're going to do some other parts. So we don't want to overwhelm our staff, especially because, the pandemic and how, all these other different practices and all these other things that they need to do. But in what I've seen is we're doing it in parts, like, introducing what trauma is and how does it impact and what can we do? And hopefully we get to that part where we're doing the healing. That's how we're doing it in our district. I don't know, Johnny, I know as a trauma-informed educator, what have you seen?
Absolutely. I think if we were to think about Project HEAL's programming, we have 3 phases. Phase 1, trauma-informed education for school staff and school admin. Phase 2, establishing meditation and calming centers for students. And then phase 3, the facilitation of trauma-informed education for parent and caregivers. Through this 3-phase approach, we establish a trauma-informed infrastructure at the school or the organization. So over time, the trauma-informed culture will be established. And then we take a step back and watch the trauma-informed infrastructure be run in a contextualized fashion by the organization or by the school. The difference between the trauma-informed component and the healing component is trauma-informed. The trauma-informed approach, in my opinion, is the education. But the journey of the healing begins when we present the culturally relevant contextualized practices to support the constituents as they heal through stress and trauma that is inflicted upon them in their socioeconomic situations or socio-demographic situations.
Thank you for your responses. Noble is very intentional about supporting the mental health of students, families, staff, but how do we balance potential overwhelm, and information overload for kids? Many kids just want to be kids and be back in school or get back to normal. How do we balance our efforts?
I think, and I'll take the first part of the question. We said this earlier, getting back to normal. I think we have to talk about what does that mean, right? Because, we talked about this earlier. The world that we knew before COVID, it's not here right now. And I think that we have to start there, like talking about, okay, what does normal look like for us, right? In terms of how we balance things out. I think we could start there. I would encourage parents to start there, like in developing that routine and what that looks like. And we know with school can be overwhelming. Kids want to get back and trying to navigate everything. But I think it's establishing a routine in determining what does normal look like for us.
I also want to add, like for parents and, thinking about the children, it's just let them play, going back to the basic, going outside and having those activities where they're just having fun. I mean, as Ms. Harris said, what is normal? I don't think, we can be there yet. and our lives change completely. I mean, I think we're still going to have this online teaching for a while. Like, I feel like it's not going to be fully where students are going to have that experience or those social connections that were once there. So, but I think just going back to the basics of letting them explore, letting them play, letting them go outside, because they are learning while they're doing all that stuff, you know, the playing, the going out and the running. And I think it's just having them do those things as well, in addition to thinking about what do we want to keep from before COVID, and what do we want to, you know, what new changes we have to do now, and also going, you know, the routines and the predictability, and kind of structuring that, you know, having that safety, feeling of safety that, you know, that we once had, kind of establishing those routines.
I would say that it is important to check in with your kids and make sure that they are feeling supported and that you're asking them about their feelings, but also it's important to read them and read their body language. And when they start to look away or want to, you know, giving you the sign that they are done with the conversation, then that's a good chance to stop. But then also with kids, I think a really great way to have conversations is through activity. So, you know, shooting hoops and talking, or playing a board game, something that is going to be a little bit less intense for them.
Right. And if I may share, I think that we must refrain from spending so much time in making a right choice and pursue a brave choice. And I think that as we think about balancing the work and the development of the best version of our student selves, let's be frank, for some of our students, playing outside is dangerous, right? And we have to make the brave choice of having conversations around how do we establish safe spaces in schools? What would it look like for every single Noble school to have a meditation and calming center inside every campus, so that students could feel that school is that safe place for me to go rejuvenate, feel like the best version of myself, and then I can go home and teach these same practices to my parents and caregivers who are struggling with some of the same mental health issues.
And our final question for tonight: how do mentors and parents engage young people who don't want to talk about what they're dealing with and how do they do that without being pushy and overbearing?
I think Susan touched on it just a few minutes ago in talking about doing activities with them, right? I think oftentimes we want to get right to the problem. And I think we don't develop the relationship with the child in that way where they want to open up. So I think doing activities with them, you know what I mean? Acknowledging how they feel, giving them the space and to say, hey, when you're ready to talk, I'm here, and not being pushing in that way, if that makes sense. But I think engaging them in things that they actually like to do, right? I think that's important. You can start there.
Everybody's good. Okay. I actually have one bonus question. It was more of a statement, but I think it's something that we should acknowledge. Someone expressed having anxiety and feelings about the state of the city of Chicago, going outside, you know. Are there any feedback or information, tips about dealing with that type of anxiety?
I feel what comes to mind as a Black man who has grown up on the far south side of Chicago. I've been robbed at gunpoint, and I know what it feels to walk into my home neighborhood of Inglewood and feel traumatized and have to look over my shoulder and experience paranoia. And quite frankly, I would simply recommend and use I statements. Do your best to explore, if the means are available. Do your best to explore communities outside of our own. I know a dear friend of mine, Jamal Cole, from My Block, My Hood, My City. He works with young people and offers them opportunities to explore communities outside of their immediate community. And through that significantly impactful program, a student like myself who grew up in Inglewood would have had the opportunity to explore Wicker Park and not have to navigate post-traumatic stress as a result of having lost a loved one and still wanting to play outside. And so there are a number of programs. For example, Social Works has a number of community engagement programs that offer youth an opportunity to explore neighborhoods outside of their immediate neighborhood. Now, let me be clear, our Black and brown neighborhoods have substantial assets, but to be further clear, socioeconomic disinvestment in our Black and brown communities create the conditions that perpetuate post-traumatic stress and inequitable access to transportation and resources that push us to find healthier means of play and well-being outside of our communities. And so to be direct and straightforward and offer two specific resources, Jamal Cole's My Block, My Hood, My City is a phenomenal opportunity and program for youth of color or youth generally speaking, and also Social Works. They have phenomenal youth engagement programs as well.
Okay, thank you. I wanted to take a pause to make sure that was all of the responses that we had. I really want to thank you all of our panelists for sharing your time, your wisdom, and your experiences with us this evening. Thank you to all of our attendees for joining our Mental Health Matters Town Hall. We hope that this time provided useful information and space and tips for healing tonight and well into the future. We want to express an exponential amount of gratitude to Ms. Contreras, who translated this conversation in real time from 5 different voices this evening. She is amazing. Thank you so much, Ms. Contreras, for your contribution to this event.
Muchas gracias, señora Contreras, con su contribución.
So before you sign off tonight, please take a moment to review the resources that'll show on the screen as you exit the meeting. And have
Antes, bueno, sí, gracias por acompañarnos y muchas gracias. Por favor, vean los recursos que hay y léalos. Pero antes de que se despidan, revisen los recursos y que están en la pantalla. Que tengan buenas noches.